Are you looking to build strength in your hip internal rotator muscles, but when you do exercises, you encounter problems with impingement? If so, then this video is for you because I'm going to break down why that is and show you an exercise that's going to strengthen your muscles, increase your range of motion, and help to decrease the amount of impingement you experience. Coach E from Precision Movement here, and today I'm going to talk a little bit about a problem in the hip that a lot of people experience called femoroacetabular impingement, also known as FAI. Basically, what happens with this dysfunction is when people lift their leg up, which is hip flexion, I'm flexing my hip right now, they'll feel a sudden block and a pinching sensation in the front of the hip here. Now, there are a lot of different theories as to why this can occur, and one of those that I promote is that we've got dysfunction and weakness in various muscles around the hip, specifically the psoas and the internal rotator muscles like the gluteus minimus. And there's other muscles involved as well, but those two I like to target in on for this issue because if the psoas isn't functioning properly and we're not using that deep psoas muscle to flex the hip, then what happens is we can over-rely on a superficial muscle like the rectus femoris. And when we use superficial muscles over deep muscles, we decrease the good alignment, which I call centration of the joint. We decrease that good alignment so that the pinching in the front of the hip can occur when these bones come closer together because they don't have that good tight alignment and centration. So the psoas is one issue. The gluteus minimus is another muscle that contributes to good centration and stability, dynamic stability. So that's stability when you're moving around, not just holding the joint still like when you're standing on one foot, but dynamic stability, which is when the hip is moving. We need multiple muscles to fire at different times, and the gluteus minimus is one that we need for decreasing this impingement in the front of the hip. And I've actually found a study that talks about the gluteus minimus in this situation. This study is titled "Patients with Unilateral FAI Have Asymmetrical Hip Muscle Cross-Sectional Area and Compensatory Muscle Changes Associated with Preoperative Pain Level." The purpose of this study was to compare the symptomatic hip muscle cross-sectional area, which is the size of the muscle, in patients with unilateral FAI with the asymptomatic side hip muscle cross-sectional area. And the researchers found that specific muscles of the symptomatic hip displayed significantly decreased cross-sectional areas compared to the asymptomatic hip, including the gluteus maximus, gluteus minimus, and rectus femoris. So we know these muscles are weak. Now, which came first, the chicken or the egg? We don't know. But what we do know is we want to get those muscles stronger because if one side is weaker than the other, then we've got a muscle imbalance, and that's going to create further problems in addition to the impingement. Now, one issue with exercises that train the psoas and train the gluteus minimus is that we can get out of good alignment of the spine and the pelvis when we do the exercises. A common one is the floor exercises where you're rotating, the 90-90 exercises where you're going into internal and external rotation of the hip. We lose good spinal alignment, and thus we're losing good activation and training good posture, which is what we want for optimal movement in everyday life. But lucky for you, I've got an exercise that helps you to train good alignment of your posture, of your spine, of your pelvis, while working the psoas and the gluteus minimus, and helping you to build the strength up in the ranges of motion that you can currently control, and then expanding that up as you gain control and range. So this exercise is the hip axial rotation, and you need a wall for this exercise. That's all you need. Very simple. So you're standing away from the wall, about a foot away from the wall, and we just lift our knee up a little bit off the ground, and we're touching into the wall. Now from here, the setup is critical. So we want to make sure that we're not hiking our hip up like this, where my pelvis is tilted and angled. We want our pelvis to be level, parallel to the ground. So I think about dropping this butt cheek down to the ground, and I'm not really pushing hard into the wall. I'm just kind of lightly pressing into the wall. From here, I'm going to go into external rotation, which is bring my foot in across my body. Hold that for 5 seconds. The whole time I'm holding, I'm trying to lift my foot higher. And when I do that, I'm rotating the thigh. I'm not trying to lift everything up. I'm just rotating, and the thigh is rotating. And then I go into internal rotation. Now the key here is you go slowly so that you're not hiking the hip and rotating and losing your posture and alignment. So I go into internal rotation as far as I can go, and I'll feel that gluteus minimus muscle working hard. Maybe some TFL, which is okay in this case. Hold it for 5 seconds. The whole time I'm trying to get higher and higher. And then I go back to neutral, under control. I don't just let it flop down. I could do a couple reps there, and we're just training a range of motion and waking these muscles up in a range of motion that we should have some control here because it's very low. Next, we're gonna go a little bit higher, and you can choose how far you go. I like to do about 3 different levels whenever I do this exercise. So think of low, medium, and high. So here, I can go up to medium level. And again, I don't want to feel that impingement. I want to make sure I have good alignment and I'm not feeling that blocking sensation when I lift my leg up yet. So here, go into external rotation. So I'm working all the muscles. I'm not just working the gluteus minimus, I'm working the psoas, the gluteus minimus, adductors a little bit. So 5 seconds, and I'm trying to get deeper into the range. Again, I'm going slow, I'm moving slowly, and I'm not hiking my hip. I'm thinking of dropping this hip towards the ground, keeping good posture, and as I'm holding, I'm breathing, relaxing the ankle, thinking of the thigh rotating. So 5 seconds there, I can do a couple reps there, rest a little bit, and then the final level, what you want to do is you want to maintain good posture, and you want to think of lifting as high as you can go. Once you feel the impingement in the block, go just a little bit below that, just a touch below that, making sure that your pelvis is level here, dropping that butt to the ground. Now here, what I want to focus on is sucking the leg into the pelvis, and that'll get good psoas activation. And I keep that sucking of the leg into the pelvis going as I'm externally rotating, holding for 5 seconds, breathing naturally, trying to get deeper into the range, and then I slowly and under control go into internal rotation, not hiking the pelvis up, keeping level, breathing and sucking the knee into the pelvis, the leg into the pelvis, ankles relaxed, and then I control on the way down, and then I can do a couple reps there and then lower it down. What we're doing here is we're gradually, the first level, the low level, we're activating the muscles we want to activate. So we're waking them up, priming them. Then as we go higher, we get closer to the impingement range, and because we're dropping just below that and building strength there and control there and alignment there, that's going to help you to avoid that impingement and increase the range that you can flex your hip while keeping control of those muscles. Because when you strengthen a muscle in a certain range of motion, you build strength above and below whatever range that you're strengthening. So let's say I'm working a muscle right here. I'm going to build maybe 5, 10, up to 15 degrees of strength below and above that range of motion. And it's that strength and control that we need of these muscles and the coordination between all these different muscles to avoid the impingement, to keep that good centration of the head of the femur, that's the ball on the thigh bone, the head of the femur in the socket of the hip socket. It's on the pelvis there. So this exercise is going to really help you to build the strength in the ranges that you can safely do without that discomfort and the impingement feeling. And as you repeat it over time and you build that strength and control, then you're going to gradually increase the range and the amount you can flex your hip while avoiding the impingement and keeping those muscles on, building the strength in those muscles. So there's a favorite technique of mine. I've got other little variations of this technique that I use for everybody to improve the way their hips function, to improve your range of motion, and to help you move freely and without pain. And if you liked this exercise and you like this approach, check out these videos over here. And if you want more exercises like this, we've got almost 300 exercises now inside the ROM Coach app. And you can access and check out all of those exercises for free by downloading the app at this link right now. So I hope you grab that app, learn some new exercise, learn some new movements, wake up all the muscles in your body so you can get back to and keep doing the active things you love.